it's time for our health news segment, and of course, Lenore Madu is here with very important information on malaria this week.
Yes, indeed. Every 30 seconds, an African child dies of malaria. The mosquito-borne disease kills at least 1 million Africans every year, mostly children under the age of 5. This Saturday is Africa Malaria Day, a day of commitment to the fight against the disease.
This year, there is good news from the African continent regarding the fight against malaria, particularly from Rwanda. Representative Donald Payne is the chair of the Malaria Caucus in the U.S. Congress.
I had the opportunity a year or so ago to visit a rural community in Rwanda where they've had tremendous success, and we saw a house that it's a whole process they go through at a community meeting, at either a church. It's a whole community effort because you have people who go in as sort of social workers to explain to folks, and then the bed nets and so forth.
Rwanda, as well as Ethiopia and Zanzibar, have succeeded in reducing the number of malaria cases with a combined approach. The use of bed nets treated with insecticides, indoor residual spraying, and adequate treatment. But despite such progress, malaria remains a life-threatening problem for many people throughout Africa. Dr. Sam Zaramba is with the Ministry of Health of Uganda.
That is a big challenge. It's easy to talk about it, but it's very difficult to implement in our setups because the majority of our people live in the rural communities, and therefore to access them is a big problem. Or they accessing to our health units is a big problem. The infrastructure is still very weak, so that to get to the nearest health units many times takes a long time.
Some consider malaria a disease of poverty, and the poor often do suffer the most. Although malaria is relatively easy to treat, many people continue to die because they cannot afford or don't have access to adequate treatment. Dr. François Bompard is the Director of Access to Medicine with Sanofi Aventis. He says the drug ASAC, developed by his company, helps to address issues of cost and effectiveness.
With just one single tablet a day, you can treat children up to 14 years of age, and then 2 tablets a day for adults. This is the simplest dosing regimen you can think of. What the NDI did also is they challenged us to make this medicine affordable, and that resulted in us committing to make this drug available at very low prices. As you can see, we have the same drug with 2 brand names. In the public markets, this drug is called artesunate amodiac in Winthrop, and it's priced at the lowest possible level, $1 for an adult treatment course, 50 cents for children's treatment course.
But Dr. Bompard says medicine alone cannot combat malaria. He says educating communities also is important.
Drugs alone are not enough when it comes to malaria, and we have developed a toolbox that is provided with the drug we have just shown you, ASAC. This toolbox is adapted to the various layers of the healthcare pyramid.
But despite such measures, Dr. Zaramba says much still remains to be done.
If the pharmaceutical companies like Sanofi could come out with the products that are very cheap, that can be accessed by our people, it would be wonderful. Because the governments are trying their best to make sure that the drugs are available, but they can never satisfy the entire communities. So we want to make sure that even those private sector, the drug shops in the villages, have actually got these medicines at an affordable price.
With the work of non-governmental agencies, such as the Bill and Melinda Gates Foundation and the President's Malaria Initiative started by former U.S. President George W. Bush, many hope to see malaria eradicated from Africa and the rest of the world. Lenore Madu, VOA News.
A delegation of high-ranking African health officials is visiting the United States, seeking support for better health on the continent. Dr. Lilian Kocholia is with Kenya's Health Ministry. She raises concerns about how malaria affects pregnant women and children.
Malaria is a big problem in Kenya, especially for pregnant women. The Presidential Malaria Initiative, that is helping them to get the nets that they need so much. But as we say, the problem is big. With children, we would like better access to the drugs because of the expense. We need the prices to come down, and we hope that we can get some support from the American government.
Moving on to another subject, Nobel Peace Prize laureate Muhammad Yunus of Bangladesh is developing a low-cost healthcare network for his country. Yunus gained renown for establishing a bank that makes microloans to the poor. He spoke about his new venture at the World Healthcare Congress in Washington. More from Voice of America's Catherine Cannon.
For many Bangladeshi women and children, paying for healthcare is not an option. But Professor Muhammad Yunus is working to change this.
Being poor and being poor in health is synonymous. There is no difference between the two.
Yunus became a hero for many in Bangladesh after creating the Grameen Bank. It provides small loans to people, mostly poor women, so they can start their own businesses. The bank's success earned Yunus the Nobel Peace Prize in 2006. He says giving the poor the opportunity to earn more money will in turn improve their health.
But I was always insisting, income is the best medicine for the poor people.
Speaking this week at the World Healthcare Congress in Washington, Yunus described how he is taking Grameen to the next level by developing a healthcare network and health insurance for Bangladeshis.
Our health insurance program requires a premium of $2 per year per family. So if you pay $2 up front, your whole family is taken care of in terms of healthcare.
The program, Grameen Health, now operates 51 clinics throughout Bangladesh. But keeping doctors in rural areas is difficult, says Yunus, so his network is working on using cellular phones and the internet to transmit patient information to doctors far away.
So we want to bridge the distance between the doctor and the patient by the information technology.
Yunus said he hopes the program will also encourage Bangladeshi women to train as nurses, because there is a shortage of nurses in the country.
We can run them through the nursing colleges, and they become good healthcare workers, and they will fill up the gap.
Yunus says his health program is intended to help those most in need, which he said are children, adolescent girls, and women. By providing them with health care, Yunus says he can transform the entire health system in Bangladesh. Catherine Cannon, VOA News.
And that's your health news.
Well, thank you so much, Lino. Of course, it's always good to have you here every Tuesday and Thursdays. Please always be sure to tune in on In Focus.
For more information on these stories, go to voanews.com/TV to Africa.